Thank you everyone for joining us for our event today. We're doing a lunch and learn, which is a little different than what we're used to with our evening events. And today we're going to have a talk by Evidence Aid to talk about knowledge translation and the work they do within that field. So we're going to start off quickly with a land acknowledgement. Oh, there we go. So if you haven't come to any of our events before, hello, my name is Jenny. I'm one of the workshop's co-leads, and currently I'm calling in from Milton, Ontario. So we just like to acknowledge the land that we gather on as part of the treaty lands and territory of the Mississaugas and the Credit First Nation, and that we recognize the traditional territory of the Huron-Wendat and the Haudenosaunee people. We further acknowledge the First Nations, Inuit, and Métis people whose lands we currently live on today. And we encourage you all to also take that time to acknowledge the spaces that you occupy and the rights and privileges we have on this amazing land. And I'm sure a lot of you are also calling in from around the world, not just Canada. So we're really excited to meet you here today. So for our Evidence Aid Lunch and Learn, we have two main speakers coming from the organization. First, we have Claire. So hopefully you can see Claire there. And then we also have Anna, who's also here with us today. And so I'm going to hand this over to them to tell us a little more about the work that happens at Evidence Aid.
Thank you, Jenny. So first of all, some very quick thanks. Thanks to the Global Health Annual Review for inviting us here today. We're really honoured and pleased to be able to talk to you. I also want to thank my co-presenter, Anna. We're hoping that we'll be the dream team, although we're one down from what we normally are. So forgive us if we get stuff wrong. And I'd also like to thank you all for taking time out of your busy schedules, especially over lunch. I'm hoping that most of you are munching on something. I am speaking to you from Weymouth in the UK, in Dorset, and Anna is coming from Colombia today. So we're also an international team. We're going to talk to you today about translating systematic reviews into plain language summaries, using our resilient health collections evidence collection as an exemplar. So Javaria, next slide, please. So why summarise systematic reviews? Well, summarising systematic reviews is crucial for evidence-based policy making and emergency responses because this has the effect of saving lives and resources, which are clearly critical in many countries. Health and humanitarian crises demand timely decision making, making evidence support even more vital in those situations, particularly where populations are vulnerable and health systems are collapsing. Targeted evidence resources are essential for improving the use of research evidence in policy and in practice. And we need to think about how we tailor these to the target audience. Next slide, please, Javaria. So how do we know these summaries are useful? Evidence Aid evaluates the effects and the effectiveness of published summaries by tracking their usage, analysing analytics, and collecting feedback from stakeholders and users as well to identify areas for improvement. So we sort of work on a feedback loop that says, you know, publish, get feedback, improve, publish. A mixed method study conducted over 2 years in 2020, published in 2023, led to the development of an evidence summary template, which we're going to talk to you about later, and training material, enabling Evidence Aid to enhance real-time decision-making in crises. And that's basically publishing these plain language summaries, which should tell the user they either have the answer that they need to read further, or that systematic review is not relevant to their decision making. Next slide, please, Javaria. Javaria? Oh, great, thank you. So how do we summarise systematic reviews? Summarising systematic reviews involves determining the content, developing a template, and gathering feedback for continuous improvement. And that's the loop that I was talking about earlier. The process includes considering the input of clients and others, creating a template format so that volunteers and paid staff can work on that format and follow that format so that everything's very structured, and incorporating the feedback from stakeholders. And the aim is to produce summaries that policymakers find valuable and appealing in their decision-making process. And it helps them to make a very quick decision. Next slide, please. So what's next? This slide outlines the process of summarising a systematic review, which includes allocating a writer, a checker, and after which the writer drafts the summary. The summary then goes through a rigorous editing and checkpoints to ensure consistency with the template and also accuracy of the content. We assign categories based on the subject heading, the topic, and how that evidence collection is structured within our website. And lastly, the summary is sent to the finalizer, who sends it to me, not the operations manager, but that's because that's who I am. And I publish it, at which point it's freely available to use. And just to flag at this point, it also goes to translation, and all of our summaries are also translated into French, Spanish and Portuguese, and some of them into many more languages. So some of them are up to 9 languages. So for example, the earthquakes collection have been translated into Japanese. The COVID collection has been translated into Arabic. So there are many different languages of different collections for different collections. Next slide, please, Javaria. So Evidence Aid is going to demonstrate translation of systematic reviews into plain language summaries. The reason that we're using the Resilient Health Systems collection as an example is that A, it's the most up-to-date collection, B, it's client-led, which means basically that's the decision makers who are telling us what they need and what they want to do. And it's also a collection that's evolving in that feedback loop over time. We've done phase 1 and phase 2, and we're just about to start phase 3 of that collection. And that tells you it shows you that the fact that it does evolve over time and it responds to the client need. Next slide, please, Javaria. So here we prioritize research, and we summarize efforts to ensure improved access to reliable information. We work with librarians and information specialists to search for high quality, relevant research for health emergencies. Stakeholders worldwide rely on Evidence Aid for rigorous and reliable evidence-based research. Our scientific leaders assess the evidence's rigor, provide evaluations, and summarize the available levels of health and emergency response and preparedness. I think it's important that we sort of take a minute to think about this and to think about, you know, as a student, if you find a systematic review, you're likely to read all the way through it. But how far through it do you realize that it's not for you? Is there an easy process whereby you can assess whether it's what you want to read? And that's essentially what we're trying to give to policymakers, is that easy decision-making tool as to, is the answer here, is it not here, or do I actually need to read a little bit further into this article? Next slide, please, Javaria. So these are our 7 interconnected collections. We do have other collections as well. So we have Zika, which is sort of slightly to the side, and I can't remember which ones are missing. We have climate change. No, I've got climate change on that. Okay, so there are 11 altogether, and I can't remember them off the top of my head. But this just shows that they're diverse but interconnected, and they build on a resilient health system capable of the need for withstanding crises. The COVID-19 pandemic and the rising number of crises highlight the need for resilient health systems, because if your health system falls, then you've got nowhere to go. Your population are at a loss. They need that support from the system itself in order to be able to become resilient and to prepare for the next emergency. By examining vulnerabilities and focusing on specific areas, the collections all help strengthen our health systems because they provide information that is from robust and good sources, so systematic reviews. Next slide, please, Javaria. So searches are conducted by topic and results are screened for systematic reviews. We consider the publication data, the topic, methodology, and findings, and this helps in selecting systematic reviews for summary. Next one. Should be another one. Great. So the user-friendly website that we have, which is www.evidenceaid.org, offers categorized summaries that are cross-linked with other collections and reviewed by stakeholders like the Pan American Health Organization. Evidenceaid.org provides over 200 published summaries just in the Resilient Health Systems collection, and users can search by collection. So across all of the collections, we've probably got in excess of 1,000 summarized systematic reviews. And the summaries, as we said, are drafted, edited, confirmed by PAHO, sent for translation into the 3 different languages, and then published on our website. Next slide, please, Javaria. So at this point, this is this is the sort of first page of the Resilient Health Systems that you'll see. You'll see there that you can choose your language. And at this point, I am going to hand over to Anna, who's going to take the reins from me, and she is going to talk you through exactly how we prepare and what is contained within a plain language summary.
Thank you so much, Claire. Can you hear me well? Perfect. So this is our Evidence App website on the Resilient Health System. And if you see, this is the one in English, but it's translated to many languages. And here you can go to categories or also individually to each summary. Next slide, please. And over here, you can search all the resources that we have by language, by date, by collection, and go to each summary. Thank you. So as Claire said, we have been working for 3 years, and we already went to our phase 1 and 2, where we summarized about 200 systematic reviews. And in this next phase with PAHO, we are expanding their priorities regarding migration, climate change, and we are also expanding collection and topics and broader their use in communication. And regarding the analysis, there are some implications for field, what is stated in the reviews, and we are also working on evidence gap maps. So now I'm gonna show you here, at the end, we're gonna show you an example, but here, this is how we summarize those systematic reviews. This is the template. So first goes the citation, that it's different from a Cochrane review to a regular review because of the city number, but we do use Google Scholar for their Vancouver style citation. And then we do add the DOI of the review, also the link of each review, and we say if it's free to review or not, and if there are any funding sources that the authors reported within the review. So this is like the first part of our summary. Then we go to language because there are some reviews, especially the WHO reviews. They do have their abstract in multiple languages, or sometimes the review is published in 2 different languages. So we do state if these reviews are in 1 or multiple languages, as you can see here. And also if there are some other ways like audio podcast or videos from the reviews. So we also state that. So as you can see here, this is an example where we do have the title of the review, when was it added, the citation, the language. This one, for example, only has English as their language, so their abstract and full text are available in English. It's free to review, and then we add the funding sources that these authors stated in the review. Then this is another section of the review where we start writing and summarizing the review. So we start with different bullets that are going to introduce the review. And then we follow this template right here at the bottom, where we say in this review, and we say if it was a systematic review, scoping review, rapid review, or if it's Cochrane or Campbell. And then we go for the criteria, inclusion criteria of the review. So we insert the type of studies, the focus of the study, and the setting. And then the research restriction, if there was any language where they did restrict, or date of publication or type, and also when was the search conducted. If it's a rapid or living review, then we'll leave the last time when it was conducted, or between which times and dates it was conducted. Also, how many studies they did include, the type of studies, and their countries. And also, if it's a Cochrane review, we do add ongoing studies and waiting for assessment. So this is an example of this review. It was, let's see, it was for interventions for improving health outcomes of newborns. And then we summarize like the method section of each systematic review, and including their inclusion criteria and how many results they had. So we do use what works and what was found. As you could see, the last example was what was found. And it differs from if the review was evaluating the effects of interventions, or if it was a descriptive review. So depending on that, we're going to follow the summary, because if it is from the effect of an intervention, we can say from the review that something worked and that something does not work when the authors describe that there was no effect of evidence of harm. And then we can also add what's uncertain when it is intervention review, because we use it when authors state that there's something that the effects were uncertain. There were some interventions where the effects were uncertain, so we use this one. But if the evidence on the review is not enough to conclude that something is beneficial, we say that we rather include it here in what's uncertain than in what doesn't work, because we don't make assumptions from the reviews, we just extract information. So this is the review was a what was found one. So we do summarize their findings over here. The most common types of essential newborn care reported were thermal care and feeding support. And we do summarize also the strategies that were used, but we stick to 1 or 2 paragraphs. Then we do have these implications section. If the authors had some implications in the conclusion or discussion. And then we do use other considerations where we go to the discussion and we see if these authors did discuss their findings in some specific context. And we do have the health equity ones. We use place of residence, race, ethnicity, culture, language, occupation, gender and sex, religion, education, socioeconomic status, social capital, or personal characteristics associated with discrimination. So we do say the authors in the review did discuss their findings in the context of let's say, place of residence or social capital. Or if they did not, then we say that they didn't discuss their findings in this context of health equity, but most reviews do. So in this one, they did in place of residence, and their implication that they had, we just paste the implications from the review. So this is a full example of a summary. We took a screenshot from our website. So this is the title, citation, language, everything that I have showed you. If it was free to review the finding sources, funding sources, and then we have what is this, what was found, and the implications. So as you can see, it was a full systematic review, maybe 20 pages. And this is a way that we can summarize and properly read a systematic review from just a quick summary. And this has been great for our policymakers and consumers to see and to find those results.
Thank you, Anna. I just want to say thank you to everybody for listening. Evidence Aid does push out 2 publications each month. That's all it is. We push out 1 newsletter and 1 bulletin. The newsletter contains sort of more of a general news, and the bulletins contain summaries that we think are interesting to our users. And there's usually three summaries within the bulletin. And if you'd like to sign up to the newsletter, if you can send your details to info@evidenceaid.org, and we'll make sure that happens. We also have quite an active social media presence, and you can follow us on Twitter, Facebook, Instagram, and LinkedIn. And if you're interested in volunteering or interning, I'm going to hand over to Jenny just for a few minutes to talk about internships, and hopefully Javaria will also be able to talk to you about this, because Jenny was an intern last year and actually worked on these summaries specifically, and Javaria is our current intern along with a couple of other people from McMaster. So I'm going to hand over very quickly to Jenny and Javaria, and hope that they'll be able to inspire you alongside of what we've said.
Yeah, absolutely. Thank you so much, Anna and Claire. If any of our attendees have questions, thoughts, or contributions, please feel free to raise your hand or put that in the chat. We are monitoring the chat for any questions or concerns, or any inquiries you might have regarding knowledge translation. But as Claire mentioned, I was a previous intern throughout the summer during my global health practicum with Evidence Aid. I was helping with the earthquakes collection. And honestly, I think Evidence Aid is one of those organizations that offers so many amazing opportunities if you want to dip your toes in what the research process looks like, or even look into how language and academia acts as a barrier for implementing the great research and work that is done within the field of global health itself. So in my experience, what we did is a lot of what's already been presented, but I feel like one of the greatest things I learned was, actually there were so many. First was probably being used to doing systematic searches. I felt so much more comfortable afterwards, because for the most part, you're working in a team, you got to learn collaboration skills, and there's so much support. Claire is so high up in Evidence Aid, but we saw her regularly. She was checking in with us, and it's something that I'm very grateful to have experienced. I did have fellow colleagues working on the windstorms collection as well, so there's so much to explore. And at first, I didn't know anything about earthquakes, but just reading through some of the full text screenings, even just working on it with Covidence, you honestly absorb so much information about the topic that you're assigned to. So if anyone here is in a global health program or even public health program, I think Evidence Aid would be a great place to do your practicum, even though I know practicum season has kind of started. So I'm going to hand that over to Javaria, because it's her practicum now.
Thank you, Jenny, and thank you, Claire and Anna, for the wonderful presentation. I started my practicum with Evidence Aid in May, and it has been such an amazing experience so far. I work with Claire and her colleague Jane, who sort of lead and kind of give us the opportunity to engage with the evidence aid, like all the different, I guess, parts that make it up. They're so wonderful. I think the biggest thing is the people who do this kind of work and who lead these organizations. You can be very organized. You can have a wonderful team, but if you don't have people who overlook and are organized and kind and considerate and meet with you regularly, it can become not very fun anymore. So it has been such a wonderful experience to work on a more international level, on a more global level, with an organization that's not in Canada, on research that is very globally applicable. At times it kind of feels crazy to read through the systematic reviews or the summaries that they've written, because they're on such a global level, you feel almost a little bit small. But then you remember you're a little part of this bigger goal that they have to provide this information to the public. And it's very wonderful work. There's so many different roles that you can play as an intern. And at the beginning of the internship, we had a conversation about what our goals were as interns. So they've done a wonderful job kind of redirecting us towards opportunities that fall in line with that. I've never had that in any job experience or any research experience or volunteer experience. So evidence aid is one of the most wonderful experiences I've had in my whole entire master's degree. I'm very, very happy that I picked evidence aid as my practicum. So if you guys are, looking for that kind of experience, 100% definitely apply this year, next year, whenever the opportunity is open for evidence aid.
Great, thank you, Javaria. And I've just had a quick look at the participants list, and I would like to give a quick shout out to Emily Mayer, who's on the call, and who is in charge of our Facebook and Instagram accounts. So thank you to Emily. I know you're out there because I spotted you. So yeah, that's the shout out that I wanted to give. But we'd love to have really good, rich discussion now over the next 20 minutes or so. So we'd welcome any comments or questions for discussion. I'm more of the operations girl, so I'll be answering those questions, and Anna's got the scientific lead on this one, so I'll be passing any of those questions over to her. And any questions about interns, of course, I'm going to pass straight over to Javaria and Jenny.
Yeah, I'm guessing some questions might be coming through in the chat, so we'll give everyone a few minutes, because I mean my typing speed is not that great. So
Anna, do you have anything to add to anything that Jenny and Javaria talked about? Because I was just thinking that you started as a volunteer and now are a paid consultant with Evidence Aid, and have been involved in many different projects.
Yeah, like as Javaria said, this has been like a great experience for me in growing not only professionally, but also personally. And I started back in 2021, and it has been amazing. And I really encourage all of you to keep volunteering, because you don't know when another type of opportunity is going to arise from that. So it's been amazing. I'm based in South America, and I had the opportunity to interact and like create a family or a community with people from all over the world. So it's been amazing. I really love it.
Okay, so either we've answered everybody's questions, which I can't believe, or everybody's actually eating their lunch and not listening. And I'm not sure which. So Javaria, I was just thinking that one of the things that you've been involved in particularly is business development. So whilst we're talking about translation of systematic reviews into plain language summaries, you've also been involved in identification of fundraising, drafting things, putting things together. So it's more than sort of the sum of a number of parts, and it is more than systematic reviews. Evidence Aid is a really small charity. We have two paid members of staff. One of them is myself, and one of them is Jane, who is just lovely and couldn't be with us today. We rely very much and very heavily on volunteers and interns. And whilst we can't pay people, we often try to encourage people to make the most of what they want to learn from us, and B, present what they're doing to whatever audience they wish to present to. And I get the feeling that that's maybe, Jenny, how you sort of came to invite Evidence Aid to the Global Health Evidence Review. Sorry, Global Health Annual Review. I've got the word evidence stuck in my head now. So it's sort of that circular thing of wanting to support our interns, not being able to financially support them, but wanting to support them in other ways. And I think that we do that quite well. And we certainly encourage you to speak out about your experiences and what you've done. Yeah. Oh, I can see a hand going on. So there's a hand up, and there's also a question that's just come into the chat room right at the same time. So Jenny, as the moderator, I'll let you decide which one you want to go for.
I think Ida put her hand up first, actually. So Ida, if you want to unmute or put it in the chat.
No worries. Yeah. The question, I just wanted to follow up on your point that you made, Claire, about business development, because I know GHAR works very heavily with that, with me offline outside of Global Health Annual Review, and also part of GHR as well. So being part of partnerships and being part of our workshops team. But I think one of my follow-up questions that I have is where does Evidence Aid receive its funding? Like, is it through mostly government grants? Is it through private grants, private applications? And if so, like how does that process work for such a charity and for an organization that is very much research focused? And how does that funding kind of spread out for a fiscal year? And I'm really interested in kind of hearing how that kind of ties into play, because as part of Global Health Annual Review, we're also looking to seek funding opportunities for our work as well. And knowing that Evidence Aid is a UK-based organization, we would really love to hear how that particular political environment and that particular geography has sort of prioritized funding for such research across the world.
Okay, so the short answer is the fact that I've told you we only have 2 paid members of staff tells you that our funding hangs on a precipice constantly. Right. We up and down the number of hours that we do and the number of days that we do. We both work part-time, Jane and I, and we respond to the amount of money that's in the bank. Evidence Aid is badly underfunded, I would say, and a lot of that is because of the area in which it exists. So we don't fit into what you would call normal funding models. So we're neither academic in terms of humanitarian, because we don't write the systematic reviews, we translate them. We're more of a knowledge translation model. And whilst we don't write them, we promote or we advocate for evidence-based decision making, and that's not a well-funded area either. So our funding traditionally has been from philanthropy organizations across the world. So we've had funding from the Netherlands, we've had funding from the US. In 2013, we won something called the Unorthodox Prize, which was specifically set up for small organizations like ours that didn't fit into a traditional funding model. We look for, we're very lucky to have some very long-standing, what you would call friends, who basically also look out for Evidence Aid and look out for projects that we can work with people on. In terms of the landscape, sorry, Ida?
No question, go on.
I was just going to say, in terms of the funding landscape in the UK versus other areas of the world, I don't think there's a huge difference. I think funding everywhere is being squeezed. I know certainly in the UK, the cost of living crisis here has been squeezed quite badly.
Yeah.
We do have a few, not very many, regular giving donors, and you can, even if you can do a very small amount, we're certainly always grateful for whatever anybody can provide.
Right.
We also look for partnership projects. So, you know, what I would say to you is, if there are things that the Global Health Annual Review are looking at that you think Evidence Aid would be make a good partner for, then absolutely shout for it.
For sure. No, definitely. I would love to take this conversation offline and kind of
Let's
follow
do
up
that.
with our
Happy to do
workshops
that,
and
yeah.
partnerships team. So that's great. We'll
Yeah.
definitely do that. Thank you very much for your beautiful
worries.
answer. Really appreciate it.
All right, thank you, Ida, for contributing. I know we had a few other questions. So in the question chat, we have Megan, who asked, is Evidence Aid working on any new collections currently, or is the focus on expanding the existing collections?
Okay, so new collections need to be funded, which ties in very nicely with the conversation that I've just had with Ida. And unless we can find funders for at least some of it, it's very difficult to create new collections. We traditionally have created new collections when there's been a need. So for instance, when the COVID pandemic hit, we were one of the very first in the arena to be summarizing systematic reviews, and we actually summarized over 600 systematic reviews over the sort of 2-year COVID period. So at the moment, we are, as I said, we are underfunded, and therefore we cannot think about creating new collections. But we are talking to people about the need for collections on age and disaster and disability and disaster. So those are the two conversations that are happening at the moment. And we are also producing new summaries for our existing collections. So we're sort of doing a little bit of both. We're advocating for funding for new collections where we can, and we're also adding to existing collections. Megan, does that answer your question? I'm hoping that's a yes. Great.
Amazing. I think that actually leads quite well into the next question in the chat, which was someone who mentioned, I was wondering how the process of summarizing the review starts. Do you work on a demand basis? Does anyone or any organization present a specific demand for summarizing the evidence?
And the answer is a little bit of both. It's very interesting. So, for instance, COVID happened, so we started to do that. We had a plethora of people who were working from home or had been stood down from their workplaces. So we had a lot of people with a lot of time on their hands. Resilient Health Systems is on demand by our client, who is the Pan American Health Organization. And so what goes in there is very definitely on demand. And thinking about the Ukraine war, we significantly ramped up what we were doing on our refugees collection when that started. And we also created from that both mental injury and disasters and physical injuries and disasters, because those seem to be quite separate to the sort of refugees collection. And that also came out of the things like the earthquakes. So things like PTSD would come under mental injury after disaster, and things like torture survivors, those kinds of things. Those are the ones that I'm thinking of. I hope that answers the question.
And to kind of expand on that, like Evidence Aid also spearheads so much more than just research, knowledge translation, but also like we've worked on projects where we translate instructions and kind of advice on how organizations can start doing their own, I believe it was health emergency response and disaster research. And so there's a lot of academics around the world who are such great contributors to the field, but we also have to keep in mind that research methodology and all this information is not accessible to everyone. Even like attending university, that's like such a privilege. So making sure we have those resources available so anyone can utilize their connections to their local community, where they're from, to provide research and to share that information with other regions around the world who might benefit from that knowledge or from their experiences is just extremely valuable. And so that's something that I've also seen Evidence Aid take such a huge role and such a lead on. So yeah.
Just
Also,
seen a question, is there a timeline for volunteer application? No, there isn't a timeline. You can apply anytime. I think there are some things that we would ask from you. First would be not to overestimate the amount of time that you have per week to volunteer, because that then becomes really difficult if we base what we're giving you on the amount of time you've said, and all of a sudden actually life's more interesting than doing volunteer work. So we always say, please underestimate and over deliver. The second thing that we say is that one of the absolute musts is that you must be a good communicator. And that's because we are such a small team and people have to work together really closely. And without that communication tool, without that sort of, ability to communicate well, we are at a loss, because that means our time, which there is not a lot of, is spent chasing our volunteers or our interns to try and find out what's happening. What we want from our volunteers and our interns, and I think Javaria would probably be quite happy to speak to this, is we want a very proactive approach. We struggle if we have to feed you, if that makes sense. We want to give you a job and allow you to run with it. We're not going to say that you've done it 100% right, and we may come back to you numerous times and ask you to change it or work a bit differently on it. But I think that in itself allows you to grow in the way that you're interested in growing, and also gives you that ownership of whatever it is we're asking you to do. Javaria, do you want to add to that at all? Or Jenny?
Yes, sure. Carujo, I don't know if you are in the global health program or if you're doing your undergrad at Mac or wherever, but the place that I heard about Evidence Aid was through the program. So it was posted on our Avenue page. But I believe Evidence Aid also puts out calls for when opportunities do arise. Like I know they had an essay competition a couple of months ago. So just keep track of their social media pages. I think everything nowadays kind of runs on social media. So just make sure to follow those. In terms of Evidence Aid itself, I think it's really important to know what exactly you would like out of the opportunity, because if you don't, you will not get out as much. Like Clara said, it's very self-run and self-determined. So you get in as much as you give. If you're willing to put a lot of work and communicate, projects usually go a little bit faster and you get to hop onto the next project a little bit quicker. Whereas if you're spending a little bit longer because you have other things going on, which is totally fine, as long as you communicate that and you recognize that those are kind of your priorities, then maybe you will get a little bit less out of it, or you'll be on a little bit less of projects, which is totally fine again. But I think the biggest thing is just making sure that you know what you would like out of the experience. Evidence Aid has a lot of different opportunities for different goals. So I did my my master's concentration in global health with a focus on business management, and that's why I was very interested in the business development aspect of Evidence Aid. You wouldn't really think Evidence Aid as a research organization or research synthesis organization would have that component, but I communicated that with Claire and I was on that aspect of the project. So I got experience with that, which is exactly what I wanted from the very beginning. So I think that's kind of my my input on that.
Thanks, Javaria. Jenny, I don't know whether you can unmute Emily for a minute, but I'd love Emily Meyer. But Emily, I think, has got quite a different experience. Emily, can you share your experience a little bit?
Yeah, for sure. Hi, it's nice to meet everyone. Sorry, I can't turn my camera on right now. It's not working. But yeah, I had originally found out about evidence aid. Actually, I'm pretty sure through randomly Jenny's LinkedIn page when I was just searching for people or like opportunities and people in the field, and I saw evidence aid. And I originally had come on as their social media person, and I had told Claire that I don't personally have social media, but I would be willing to run their pages. And she was amazing at saying, yeah, you can run the pages, but also asking what my interests lie in the global health field, because I specialize in global nutrition, and ensuring that I have other opportunities as well that I would enjoy more opportunities of what I would like to get out of the global health field. So yeah, it's been an amazing opportunity, and I would recommend anybody who wants to volunteer to contact Claire.
Yeah. And thanks, Emily. And I know since Emily's been with us, I know our Facebook community and our Instagram, well, our Instagram community has grown hugely because I don't do Instagram, so I wouldn't even know what I was doing. But Emily, thankfully, has completely taken that on herself to do. And I think, Emily, it would be fair to say that we give you fairly free rein to push out the kinds of things that we need pushing out without actually going into that nitty-gritty of the wording of such. So again, it's taking that ownership.
Yeah, definitely. You send me emails a couple times a week and say, here's some ideas for the social media. And I just take that and run with it and say, okay, I think this would be good to push out, and figure out what to push out and when. And yeah, you definitely give me a lot of free rein, which is very nice for my creative side as well.
Good.
And I think if anyone here is like a Global Health Annual Review author or a submitting author, one thing that's really interesting I would encourage them to do is to check out evidence aid summaries, because I think it lends itself very well into identifying what are some barriers in your own research, not in just in the terms of like accessing journal articles, but truly having your audience understand what you're talking about and addressing some gaps within existing research. So I know a lot of our work talks about public health and perspectives on communicable diseases. But it's also important to put in there, like, what are the voices that are kind of not heard in your work? And also, how can you make your work more accessible? So maybe that's adding more definitions to someone who might not be an expert in the field, so that they can also follow along with your work. And so those small changes that you can make really can impact others and make your work a lot easier to share and digest for people who are not experts within global health or public health.
So I think that's all the questions that were there, Jenny. We've answered.
I think that's most of it. A lot of our attendees or registrants are in different time zones, so we usually upload our events onto YouTube. And if they have further questions, if you're currently watching the recording, you can go back a little and see the evidence aid contact information that was on the last slide of the PPT. Otherwise, you can always contact us through the Global Health Annual Review, and we can always pass along these messages to Claire and Anna to answer or to put their input on. But yeah, I think that's most of the questions we've addressed. Are there any other in the chat, Javaria?
No, I do not believe we missed anything.
Okay, that's good. No, not missing.
Maybe just give anybody a minute just to put their hand up if they do want, if there's anything that's burning very quickly. But if not, I'm going to put my email address in the chat. And although I'm not always the fastest person to reply, and that's just because of the workload, I will reply, I promise you. And I will be really interested to hear from any of you, with even whether it's intern, whether it's volunteering, whether it's absolutely nothing to do with that, and you've just got a question about evidence aid that you need an answer to. I'm more than happy to be in that conversation with you. I think Anna's probably the same. Anna, do you want to pop your email address in the chat too?
Yeah, sure, I will.
Because I'm reckoning that most people will know how to get in touch with Jenny or Javaria through McMaster. Great, thanks, Anna.
I think, yeah, if anyone's still typing, feel free to throw a question or something in the chat. We welcome that. And if you happen to be at our career panel a few weeks back, you know that, always reach out. Opportunities are the ones that you really make. The worst case scenario, if you ever want to intern somewhere or learn more about an organization, is they give you a bleh answer. But sometimes there's a lot of opportunities that pop up. So networking, it's something we strongly suggest over here. So I think we're gonna wrap up for today. I know most people are probably on their lunch breaks and probably need to get back to work. But we thank you all for taking that time out of your day and enjoying your meal with us here for Knowledge Translation with Evidence Aid. If you're interested in more Global Health Annual Review events, we always put the registration on Eventbrite, so you can follow us there or on any of our social media links that were also linked on our Eventbrite. We are going to send out a workshop feedback form for everyone to fill out. It is definitely optional. You can make it anonymous. It does not record your email account unless you want to leave that information with us. It's just so that we can improve the experience for attendees and to create workshops that you're interested in and you find valuable or insightful moving forward. And as always, check out the Global Health Annual Review. We're currently in the process of getting issue 8 out soon, so keep an eye out for summer events and our fall launch party. All right, have a great day, everyone. Thank you so much.
Thank you.
Bye, everybody. Thanks for listening.